Hi, this is Evangeline Hundley, and I'm running for US Congress against Ralph Norman so I can represent the people in South Carolina's 5th Congressional District. With that being said, today is the third of a 5-part series called Medical Mondays, where we're discussing very important topics about healthcare in the state of South Carolina as it pertains to affordability, access, and outcomes. Healthcare for all is what I want for South Carolinians, and nothing less. As your next Congresswoman, I, Evangeline Hundley, will work every day to make this happen. First, I will advocate relentlessly for opening the Medicaid Exchanges in our state, and then ultimately vote for healthcare for all. It's also referred to as Medicare for all, single payer, universal health care, but the bottom line is that no citizen in the wealthiest country in the world should be without quality health care. And South Carolina is among the last 12 states that have not offered this help to its tax-paying citizens. Again, the purpose of this series is to inform you of how policies made at all levels of government affect your health. South Carolina is in a healthcare crisis. Lack of affordable and accessible healthcare is literally keeping us sicker than we have to be and killing us prematurely. Before we get started, though, it's important that you know healthcare for all is at the top of my platform list. Everything on my platform list boils down to one thing, and that's you. And in this series, it's about your healthcare. Today, our topic is about how healthcare for all can work for us and about Medicare. And we are so lucky to have Dr. David Keely as our guest today. Dr. David Keely is the president of Healthcare for All, South Carolina. He is semi-retired as a public health policy educator and physician epidemiologist with primary care medicine and public health synergy. He has been practicing in the Chester, Lancaster, and York County region since 1979. He grew up in Philadelphia and obtained his bachelor's degree from Swarthmore College and his medical degree from Wake Forest University. He did his family medicine residency at the Medical University of South Carolina, and later he did the MPH program at UNC Chapel Hill School of Public Health. He practiced family medicine for over 30 years in multiple settings. He was the full-time 3-county public health district director for South Carolina's Department of Health and Environmental Control for 8 years. He also served in the National Health Service Corps for 2 years. And here's another fun fact. In 2009, Dr. Keely was instrumental in achieving a 100% smoke-free workplace in York County, South Carolina. And without further ado, I'd like to introduce to you Dr. David Keely. Thank you for joining us. We are so happy to have you today.
Thank you, Candidate Hundley. It is indeed a pleasure, and this topic is right up my alley, and so hopefully we can share some meaningful information, and voters in the 5th Congressional District can understand how important healthcare is overall and how your platform is really, making it a priority. As you know, my primary care and public health background have led me over the past 12 years. I've become an activist in South Carolina. Activist is probably an advocate who speaks more loudly. And I have joined a group of over 25,000 physicians across the country. The organization nationally is Physicians for a National Health Program, and I'll talk a little bit more about that. I am pleased to be the president of the South Carolina chapter of the Physicians for a National Health Program, and our our name is Healthcare for All South Carolina. We feel that universal healthcare is attainable. We feel that access to care, affordability, quality, and sustainability can all be a part of that. Medicare has been a very successful program since 1965. If you look at data on life expectancy and quality of life in the United States since 1965, seniors in the United States have really surpassed other seniors around the world in those areas of longevity and quality of life. Why not take the Medicare model, make some improvements? As a physician, I know some of my colleagues, we have some things we'd like to improve, but take that successful model for the past 57 years and expand it to everybody. When you're born, you get a Social Security number and you get a Medicare card.
Oh, wow. That would be nice.
Yeah.
That would be awesome.
And, the simplicity of those of you who are near my age remember how simple it was when President Lyndon Johnson just signed his name to a Medicare card, and he had coverage. All of the things that have happened since then, the complexity of the private insurance industry, and the way that hospital systems have developed, it can be very confusing for seniors. And so, how can we make a difference in that? Well, we can improve Medicare and give it to everybody. And
So if do you mind if I ask a question? How do you feel about the idea that Medicare for all? I read somewhere that this is what it does, and I'll just read it because it sounds ideal. Simplicity is obviously what we need. It's way too complex getting healthcare. It's way too hard to access the healthcare, and you can't afford it when you do find the healthcare service you think you might need. And so your outcomes are not going to be what they can be if you had access and could afford it. So Medicare for all seems to be, and again, it's the phraseology Medicare for all because that's a model that has worked so very well in the past. Now we'll get on the parts of Medicare that maybe don't work so well that people are dealing with, elderly, parts A, part B, and we can discuss that. But I personally would be for Medicare for all, Medicare period, no parts whatsoever. But
yes, that's a good way to lay it out. The Part A, Part B, Part C, Part D, that has all been evolved because of the influences of the private insurance industry. What we're talking about is a publicly funded but still privately delivered system that has a single payer. So networks where you're getting services out of network and you pay an excess amount because you're out of network, that all goes away. It's just one insurance plan for everybody. The billing, all of the people that are hired in hospitals and doctors' offices and clinics, they have to learn all these different insurance plans and all the different rules that the different insurance companies have. So that's a big saving. If you have a single system of Medicare for everybody, you save $700 billion a year in administrative costs.
Well, is it true then that Medicare for all will allow everyone to receive quality care that is affordable, whether at the hospital, doctor's office, emergency room, or pharmacy? In that it will eliminate copays, deductibles, premiums, and provide reproductive care, home health care, maternity care, mental health care, dental, vision, substance abuse, prescription drugs, hospital, and long-term care. it will greatly improve the lives of long-term health by reducing maybe underlying conditions, right? I mean,
That's correct.
is this right?
Yes, preventive care. You probably are hearing, citizens are hearing about pre-diabetes. If we identify and help people with pre-diabetes never to become a diabetic, if we help people with early lung disease from asthma, stay better control, excuse me, and if people who have high blood pressure, if they are well controlled throughout their lifetime, then their chance of having a serious stroke or heart attack, potentially fatal, either one, that all is, there's an additional savings of several $100 billion that will occur because of that access and preventive care. You mentioned drugs. One thing that's definitely going to be improved, and we've taken a step recently in the Biden administration,
Yes.
is to have the federal government be able to negotiate the price of drugs, which is exactly what the VA system has been doing for years. And so why can't we get that for everybody? And the challenge, of course, and voters need to know this, the challenge is that our elected representatives in Washington, D.C. are receiving campaign finance money so that the elected officials will support these ideas of privatizing healthcare and and maintain and continue this complex system in our country that is not
enriches. Yes, it just enriches the people at the top. It's big pharma that is benefiting the most from the suffering of the people. And that's why we're not going anywhere. That's why we keep repeating these cycles and we can not get the progress that we need. But I hope that everyone on just taking from what you said of what the Biden administration has recently been able to pass can see that progress can be made when you have the right representation and people who are very clear about the needs of the people that they represent. And
they're also transparent about where the campaign support money is coming from, so that you can know that your elected person has your best interests and not the interests of these big corporations, and as they're driving their decisions.
Which has been the case. And what we can do is do two things. One, see where the money is coming from. And two, look at their votes. I think the biggest tell is no matter where your resources are coming from, that it doesn't control your voting. And that is the key. It doesn't keep you from representing the people that you're supposed to represent and the causes that you're supposed to, if that were the case. Now, I do just strongly look at the voting records of people, and including myself, which we'll be able to do when I'm in Congress. That is one of the things that means the most to me, is accountability. And so that I'm sitting here on these series of Medical Mondays explaining to you how healthcare is so important and how it's lacking so in this state and what we can do to change it. But you'll be able to hold me accountable when I go to DC and see what votes I'm taking that will benefit the people in this district and in this state and ultimately in the nation. So
you speaking of the state,
and this is, I wanted to go.
One of the things that Healthcare for All South Carolina is focusing on now is what is the step that we can take right now in South Carolina to expand coverage and make quality healthcare affordable and accessible. And that happens to be the topic of expanding our South Carolina Medicaid system to working families, and to make it so that if they don't make enough to be able to purchase health insurance through the insurance exchanges, through the Affordable Care Act, and they make too much money because they're working, they're doing their part is to to earn and be sustainable citizens and families. If they make too much to qualify for the current Medicaid system, we're talking about adults, children are pretty well covered.
Mhm.
Then we need to expand and make that change in our Medicaid system. Let me show you quickly what I'm talking about. Here you can see on the graph the red zone, which is a very important number of people. Over 200,000 South Carolinians fall in in that zone, which includes low-income families and childless adults. And you can see that once the Medicaid is expanded, we will have over 200,000 people that will then be able
eligible now for.
Right, will be eligible to be able to have their blood pressure controlled, keep up with their preventive services. And other states that have expanded Medicaid have shown that they have actually saved money in the state budget. Our current elected officials in Columbia claim that if we expand Medicaid, it will balloon into an unaffordable, unsustainable coverage and commitment. And that is not true. The other states that have done this have shown that there's significant
savings to be made.
Correct.
And doing this efficiently, and we'll come up with any excuse that we can find in this state not to do right by the people.
We have to pay attention to what the voters are thinking. And what this shows is that there is across the board majority of South Carolinians, whether you're Republican or Democrat or independent, who support the idea of expanding Medicaid, as we just got through talking about. So this is
because they need it. They need it.
So this is something that you, as an elected official, can have a voice about, and have your colleagues, other elected officials, realize that this is a no-brainer, really, for South Carolina.
So how long has Healthcare for All South Carolina been in existence?
Yeah, we've been in existence for 12 years. The national organization has been in existence since the early 1990s, and there is a really rich amount of material that voters can see, I'm sure, on your website, but also on the Physicians for a National Health Program website, pnhp.org. That is where I would have folks to look, and you can see how many physicians have made the case that this is a system that is publicly funded. Right now, a family of four in South Carolina is paying about $24,000 a year. The single payer finance system, that would be reduced to about $8,000. And so there would be no co-pays, no deductibles, and the way that money would be obtained to fund the system is, through a tax system. But the bottom line is that what people are paying out of pocket now is 3 times what people would pay under the single payer system with everybody covered.
That it seems like a no-brainer. It's getting the people in our state who have been holding out from voting, not fully connecting the dots as to how their vote affects their everyday life and their health care. I want to touch a little bit on what you see in your profession or have seen over the many years practicing of the healthcare disparities. I see divisions in this way. It's economic division mostly. We do have racial disparities. So there's race, but I would say heavily and mostly it's economic, because those are the voters that need to get out. That was my point, is that the voters that need this the most are the ones who really have to come and make their voices heard.
So well said. The big issue is that we have working people who are even doing 2 jobs and not being offered health insurance, and they make too much to qualify for current South Carolina Medicaid insurance, but they don't make enough to afford, buying it on the private insurance exchanges.
Now that's the gap, right? That gap that needed to be closed. And I know President Biden was working on closing that gap, but it's just from the federal level, right? Again, we're dealing with what happens at the federal level and then it not being able to go into effect on the state level because we don't have the right leadership in place, which is why, just side note, we also need governorship changed, and that would help to move this right along.
Yes, I can say that unfortunately, our U.S. senators from South Carolina did not support having close the coverage gap for the 12 states that we've mentioned from the federal level, and they also limited the extent of the fair pharmaceutical pricing.
You see what happens, listeners, is that no matter what we do at the federal level, there are still people, even within the federal level, who are supposed to be representing us, who do everything they can to block health, to block help, to just block stuff that would benefit you.
Right. And as you say, at the state level, we currently have a governor who has not seen fit to accept federal funding. The federal funding to expand Medicaid, if we talk about that again, 90% of the cost for expanding Medicaid in South Carolina will be covered over the next at least 5 years by federal dollars. The fact that we don't do that means that actually South Carolina taxpayer dollars are going to support Medicaid in other states.
Oh my goodness!
Right. So, we have a governor who doesn't want to accept that kind of federal contribution, and we will have a chance to make a choice about that
coming right up.
Coming elections. Yes.
November 8th. Yes. That's the beautiful part about all of this at this moment, enlightening people, letting them know what is available, how we can make a change, and then doing everything that we can to get people out to vote their interest is going to be the key to tying this all in. All the work that's been going into helping people with doctors like yourself, the organizations. It says a lot that when you have a group of healthcare professionals who are advocating a system of healthcare for all, you have to stop and ask yourself, what's wrong with the politicians that they won't even listen to healthcare professionals when it's important for us?
The polling that is done of physicians in currently in practice reveals that 93% of practicing physicians support improved and expanded Medicare. So
that says it all.
That's a message that elected officials, need to take seriously. Yes. Mm-hmm. I also want to mention one thing that is challenging current Medicare, and that is I mentioned the term privatized, and that is.
Yes. May I ask you about that? We see commercials all the time. Some of the old time stars are on there, and they're promoting, get your Medicare, get the plan. Was it Joe Namath? Is it Joe Namath and JJ Walker?
Hi, folks. Medicare Part C plans with extra benefits.
Hi, I'm Jimmy JJ Walker. If you're on Medicare, listen to this.
So you get the idea that is also Medicare. So could you explain how that works?
Medicare Advantage is private insurance. It is not traditional Medicare. The problem is that if you have to be in the network and if you get sick as a person of age, like I am, you're out of state visiting relatives and you have Medicare Advantage and get sick while you're out of state, you might be socked with a $20,000, $30,000, $40,000 hospital bill if, for getting sick out of system, out of network. So people who are being attracted by these benefits in Medicare Advantage are only setting themselves up for potentially a medical bankruptcy by virtue of their coverage limitations related to networks. The Medigap plans, the Medicare supplement is there is no restriction. You can go to any hospital, any physician, anywhere. So
and that's Medigap. Medigap.
It's Medigap. Medicare supplement insurance is different in that important way from Medicare Advantage. What you want to be listening for is the privatization of Medicare, and that's where if we get a majority of Americans, seniors who are on Medicare Advantage plans, that's when the leaders are going to feel the pressure to make all of Medicare private, whereas improved and expanded Medicare for all with a single payer will continue to be a public and widely accepted and lower administrative cost system. Yep.
I know a whole bunch of recipients of Medicare that will not stand for that privatization. And so this is what we're fighting against and for Medicare for all, against privatization of any of these social safety net programs that have benefited the majority of Americans.
And there's disparity. You asked about that. There's disparity and inequities in who can access the Medicare Advantage and who does well on it. Because the insurance companies, to put it simply, they want to attract healthier seniors to their plans. And so they start denying benefits and denying coverages when they get a person who's sick and develops new multiple medical problems. So it's the privatization it's profits before patients. That's the term that we use.
Traditional Medicare, what's the difference?
That's the Medicare that pays 80% of all hospital and physician costs, and leaves the person responsible for 20%. What we will do with improved and expanded Medicare is we will cover 100%.
That's what we need.
Or that 80% that you hear about for traditional Medicare will immediately become 100%. And that's why we're able to say that there will be no copays or deductibles.
Do you know right off the cost of insulin? To get it at $35, right, is the goal of the Democrats and this administration, a flat fee for everyone that's taking insulin.
Insulin is no longer under patent production. So there are many producers and they compete for share of the market. But with the price being set and not being able to be negotiated, it drives it up over $300 for one vial, which can be over $700 a month.
Uh-huh.
There are several types of insulin. There are long-acting ones and short-acting ones. And what the drug companies have done is they've made little changes in the types of insulin and how long they last, and they get a new patent. The doctors are trying to use the generic insulin, but the patients need, a longer acting or one of these that has some special properties. So that's where a high cost is also built into the system. So when you price the production of insulin, and some of it has to do with some of these specialty insulins. But you're exactly right. The bottom line is that there's a lot of profits before patients that's going on.
Yes, and I know that the federal government has done its research on the cost versus what they're charging for it. So they're pretty settled with it being capped at $30 or $35 a month, and that still being quite enough profit for everyone to make. So I trust that. That
Yeah, I think that comes from the VA system experience. So,
ah, okay.
the government does negotiate the prices for insulin and other drugs for the VA system. So that's how they know what's a fair price.
Gotcha. That makes sense.
I want to also say that if folks want to join in with advocacy for improved and expanded Medicare for all, please, we'll be happy to hear from you on our website, www.pnhpsc.org. And we have
Can anyone join, or is it doctors only?
No, it's open to anybody. We don't have dues at this time.
Nice.
If the physicians join the national organization I mentioned, the Physicians National Organization, there are dues there, but for our Healthcare for All South Carolina, there are no dues. And we do have regional groups in the Charleston area, the Columbia area, and the Greenville area, and we're working on getting a group going in the PD area. So,
and primarily, you're affecting policies and legislation. You're presenting and talking to and trying to get better health care in South Carolina, right?
That's correct. We work it to
excuse me,
at the grassroots level. We want to engage people, educate them so that then they can be a strong voice talking to their own elected officials in South Carolina and in Washington.
Well, that is awesome. It's so needed, and we are so thankful to have you, to know that this organization exists, that there are many healthcare professionals that want this for the people, that know that we need it, that see this stuff firsthand, that's happening and is working to make it happen. I mean, there's talk, then there's action. So I appreciate all the actions that you've taken over your entire life, Dr. Keely, to make our lives healthier. As my mantra says, healthier, wealthier, and wiser. I appreciate everything that you've done for the healthier part and wealthier and wiser. So I feel wiser having spoken to you.
Well, again, I thank you for the invitation, and I can say that this kind of forum that you are providing with the Medical Mondays, I hope the listeners have benefited, and certainly, you've made clear some very important things that you stand for, and I applaud you on that.
Thank you. Thank you for joining us for another episode of Medical Mondays. As you've heard me say this before, healthcare for all is what I want for South Carolinians, and nothing less. As your next US Congresswoman, I, Evangeline Hundley, will work every day to make this happen. When you send me to Congress, I will vote yes for each and every citizen to have the best medical care that you can get and that you deserve. The election is on November 8th, and early voting starts on October 24th. So you must get out to vote. You must vote for Joe Cunningham for governor, for Crystal Matthews for US Senate, for all your local Democratic officials, and for me, Evangeline Hundley. You'll find me opposite Ralph Norman as we compete to be your US Congressperson in South Carolina's 5th District. See you next Monday.